Are you overdue for routine cervical screening? It's Cervical Screening Awareness Week, which aims to raise awareness of cervical health screening. The Pap test and HPV test, which can help prevent cervical cancer or find it early. This week is also an excellent time to set a reminder to schedule this important testing. If you have a cervix, cervical screening can save your life. This video is sponsored by the National Cervical Cancer Coalition. Cervical cancer remains one of the most common types of cancer affecting women. In fact, globally, it is the fourth most common cancer among females worldwide. According to the American Cancer Society, an estimated 14,480 new cases of invasive cervical cancer are expected to be diagnosed in the United States in 2023. This type of cancer occurs when abnormal cancerous cells form on the lining of the cervix. These cells can divide and grow rapidly and may eventually form a mass of tissue called a tumor. As the tumor grows, it can cause pain and bleeding. And if left untreated, it can spread to other parts of the body. So, what is cervical screening? Unlike many cancers, it is possible to detect the early stages of cervical cancer with screening tests. The traditional test used for early detection of cervical cancer is the Pap test, a safe and effective way to discover cancer cells early when it is easier to treat. Currently, there are 3 testing options, and your doctor can help you decide which is best for you. According to the CDC, 9 out of 10 cervical cancers are caused by HPV. Human papillomavirus can cause cell changes to the lining of the cervix, and these changes can lead to cancer if not found and treated. First, HPV test only, or human papillomavirus primary testing. This test checks cells for infection with high-risk HPV types that can cause cervical cancer. Next, Pap test, also called a Pap smear or cervical cytology. This test involves collecting a sample of cervical tissue cells, which are then examined under a microscope for signs of precancerous or cancerous mutations. Lastly, co-testing. The HPV Pap co-test uses both a Pap test and an HPV test to check for high-risk HPV and changes to cervical cells. Your Riverbend Medical Associates doctor can help you choose which testing option is right for you. Who should get cervical screening and when? Cervical screening is for anyone with a cervix. If you are a trans man or non-binary person and have a cervix, you should get screening too. HPV testing and a simple Pap smear are powerful tools for preventing cervical cancer death. Cervical cancer often has no symptoms or may be mistaken for other gynecological issues, so regular screenings are important. Cervical screening for age 21 to 29. When you turn 21, it is time to begin your regular Pap smear. If your Pap test is normal, your doctor may say you can wait 3 years for the next test. Screening is not recommended for those under 21. Cervical screening for age 30-65. You should continue to get screened during this time. Your doctor may recommend a Pap smear, HPV test, or co-testing. If tests are negative, testing may be repeated every 5 years. Cervical screening for ages 65 and over. If prior testing has been normal and you are not otherwise at high risk, it's likely no further cervical screening is needed. As mentioned previously, cervical cancer is preventable when problems are detected early and treated. If you have a cervix, it's important to schedule and keep regular cervical health appointments. What to expect at your cervical screening? When cervical cancer is detected at an early stage, it is usually easier to treat. Screening tests include a Pap test or an HPV test. The goal of a Pap smear, Pap test, is to detect cancerous or precancerous changes in cervical cells. HPV testing can detect the high-risk types of HPV that are commonly found in cervical cancer and can be done on its own or simultaneously with a Pap smear co-testing. Screening tests for cervical cancer are usually done during a pelvic exam. During the exam, you are positioned on your back with your knees up on an exam table. Your healthcare provider uses a device called a speculum to gently open your vagina to see the cervix. A slender brush is used to collect a small sample of cells. The sample cells are then sent to a lab for testing. Sample cells can be checked to see if they are infected with the types of human papillomavirus that can cause cancer. HPV test. The Pap test checks for precancerous or abnormal cells. When these tests are done at the same time, it is referred to as an HPV Pap co-test. If your test results indicate that something might not be normal, your Riverbend Medical Associates healthcare provider will contact you and figure out how best to proceed. There are many reasons why test results might not be normal. It does not necessarily mean that you have cancer. It's important to follow up with your doctor right away to learn more about your results and receive any treatment that may be needed. Almost 13,000 people are diagnosed with cervical cancer each year. When detected early, cervical cancer is one of the most successfully treatable types of cancer. By getting regular cervical screening tests, cervical cancer can often be detected early and sometimes even prevented. Facts about cervical cancer. Here are some alarming facts about cervical cancer. Nearly half of all cervical cancers occur in women between the ages of 15 and 44 years old. Most cervical cancers are caused by persistent infection with certain strains of the human papillomavirus, which is very common. About 80% of sexually active people will acquire genital HPV infection at some point in their lives. However, most HPV infections go away on their own within a year or two and do not result in cancer. Regular screening tests such as the pap smear and HPV testing can help identify precancerous cells so that treatment can begin before cervical cancer develops. Get screened and help prevent cervical cancer. Most cervical cancers develop from precancerous changes in the cells of the cervix. These changes can be detected through regular cervical cancer screening tests such as the pap smear and HPV testing. Screening tests can also detect precancerous cells so that treatment can begin before cervical cancer develops. Talk with your healthcare provider about which type of screening test is right for you. Don't delay. Schedule your cervical screening test today. Cervical cancer screening tests are safe and effective ways to detect precancerous or cancerous cells. Early detection of cervical cancer helps increase the chances that treatment will be successful, so don't wait. Call your doctor's office today to schedule your cervical cancer screening. What are the signs and symptoms of cervical cancer? Unfortunately, in the early stages, cervical cancer usually does not cause any noticeable signs or symptoms. However, as the tumor grows, it can cause abnormal vaginal bleeding, including bleeding after sexual intercourse, irregular menstrual bleeding, or pelvic or abdominal pain. If you notice any unusual changes in your body, please make an appointment with your doctor to discuss your symptoms. How often should I get cervical cancer screening tests? For most women aged 21 and older who are not at high risk for cervical cancer, screening should be done at least every 3 years using either a pap test or HPV test. Women between the ages of 30 and 65 may choose a pap test and HPV test or the HPV-only test every 5 years. Can I get cervical cancer if I have had a hysterectomy? No, if you have had a hysterectomy, you do not need cervical cancer screening. However, if you have had a hysterectomy for reasons other than being pre- or post-menopausal, talk with your doctor about whether cervical cancer screening tests are still right for you. Also, if you have had a vaginal hysterectomy but still have your ovaries, you should continue to have cervical cancer screening. If you have a cervix, it is important to schedule and keep regular cervical health appointments. You can find a list of doctors in your area who specialize in women's health at the website below. Disclaimer: this video is for informational purposes only and should not be considered medical advice. Always talk to your doctor about your individual condition and treatment options. Thank you for watching. Please like and share this video. We hope that you learned about cervical screening and the importance of getting tested for cervical cancer. Don't forget to schedule your appointment today.